Today, we are going to discuss about something that probably bothers all of us when we have a health challenge, be it physical, mental, or emotional. Because being in the health industry, Dr. Nagendra sir or myself, we often encounter a situation where we are trying to convince the patient or the therapy client that the physical challenge or the ill health is indeed trying to reveal something at a higher dimension, at a spiritual dimension. But at that state of disturbance that the patient or the therapy client is, it becomes a little challenging for us to take us into that zone of understanding. So let's understand this at a deeper level from Dr. Nagendra sir from the spiritual and Vedic context. Doctor, welcome to the show.
Namaste.
And kindly share your insights on this. I'm sure you have experienced a lot of such incidences or case studies where you are trying to put your heart out to that patient and trying to reveal what the deeper knowledge, revelation that the challenge is here to express. But then in the state of disturbance that the patient is in, sometimes it could have been challenging. But for you, I'm not sure, because I'm sure you would have conveniently helped them transcend that limitation. So please share us your personal experience and also help us connect to the wisdom from the spiritual insights. If we study something out of the Vedic essence, is it going to be a little easier for us to transcend such limitations?
So this is one of my area of interest as well. See, the whole idea is what is a disease. Most of the time we don't have that idea of what is a disease. I'm at ease and if it is not comfortable, it's a disease. The first thing we need to understand is whether it is at the physical plane itself. It is only my anatomical body which is having the problem. Many times it can be just with the body. And then it can be at the energy level, what we call it as a prana.
Sure.
But again, if there is a disturbance in the prana, a very good example of disturbance in the prana is acidity or increase in the blood pressure. That's a hypertension.
Sure.
Most of the time, it's a disturbance in the functional aspect of it, manifesting in the physical aspect of it.
Yes.
The third level is at the mind, what we generally consider as a psychology.
Yeah.
But psychology is not limited to that. Mind is something, the thinking mind, reasoning mind, or which is meant for the purpose of the mind is the knowledge.
Yeah.
The purpose of the functioning of the emotion is the joy. If we can get these two very clear, then it becomes a beautiful. But how do we experience? Through physically. Experience is physical.
Right.
All the vital functioning, all those are meant for the experiencing the ananda. The whole purpose of the mind and whatever the higher above and spirituality is getting that ananda. That is the knowledge. So without the knowledge, the ananda is incomplete. Without the ananda, knowledge is incomplete. Both are. It should go together. Having just a knowledge doesn't make a big difference. So as good as having a library.
Right.
So that's how it is. Now, from the physician point of view, what we need to look at is when somebody comes in, that is the best time to get into the spirituality. It's not an obstruction at all. See, when somebody is in pain, then it's very easy. They are receptive more.
Yeah.
Rather than somebody is actually enjoying the life, you say that no, you don't do that.
Yes.
It's not required. Don't make money. Nobody will listen.
Yeah.
When you are actually in the problem, then you know that you have spent many thousands and now lakhs of rupees. Then you understand that there's something more than this.
True.
That's a time, but I'm not saying that this should be the entry point.
Okay.
They can be done something even before that. If I'm sensitive to something, if I get often headache, then I can definitely go back and see why am I getting headache? Is it because something my lifestyle is we call it as lifestyle today. What is that lifestyle? We are very happy with the word. One word, one diagnosis, very happy. That's a dangerous thing. You give some name to the fever, we are happy. But what does it signify? Nobody is bothered. That's not knowledge. Why I get suffered? That's not. Now, how Veda looks at these things is,
Yes.
it doesn't specify. Of course, there is a very beautiful explanation, Atharva Veda. Then in continuation, later we call it as an applied aspect of it is in the Ayurveda. Ayuhu is the life. Dha is something which supports. So that's the idea of doing the Ayudha Puja also in Vijayadashmi, which today has become just a material, a vehicle and a decorating. Ayudha Puja is, Professor R.L. Kashyap always mentioned this, Ayu is the life. Dha which is supporting that.
Okay.
For an engineer, it is a laptop, or for somebody, a driver, it is a vehicle. For a doctor, it's a stethoscope. So for a student, it's a pen, pencil and other things. That's Ayudha, or even a scholar. Okay. So what is that supporting this life? When I go from that perspective, we understand that why there is a disease as such. And then how do I heal? Because the disease is because the disturbance in the prana. Even if it is the most physical problem only, as simple as it can be taken as a hair fall. So it can be because of some bad shampoo or because of my too much of worry or anything. But ultimately what is more important is there is something triggering, my body is triggering something, that is something going wrong, how do I take it inside? And then look at the problem. This problem will not solve only this particular, when I go inside and try to that aspect of it, it will not only solve this, all those related in this realm, all the second handle. Like a child getting a headache, if because of no other physical problems, if it is because of the vital energy imbalance, and we try to fix it, it will know how to handle any stress in the life, because
like
this
a
is one
portal.
stress.
Yes.
Yes, this is one stress. So this can become an opening for the complete. It's a representative. Symbolically, it is giving this. If I clear this, like you complete your 10th standard, now anything you can take. You can go to science, commerce, arts, anything you can do.
Yeah.
So in that plane, everything is cleared. To that extent, a disease can be definitely helpful to opening, or even that for matter, that is a death. So whenever there is a death, we have a term called Smashana Vairagya. At that moment, we become very spiritual. That's not actually spiritual, but we say that this is the limited world, this is what it is, momentarily for a few days or a few months, if it is very close, maybe years together. But gradually it fades down. But what is that is actually helping to try and come out is, there is something in the world which changes continuously, that is the physical world. There is something which cannot change, that's a non-physical, that starts from the prana, and then what is actually holding this, that is myself, the spirit. So this is how it is, the Veda looks at it, and then even physically we are not different. For the purpose of action we are different. Now you are asking question, I am answering. There are two persons. Actually it's the same thought that going on, to somebody who's sitting there, and then as a viewer, and then seeing that he is listening. It may be his own question or her own question, and then her own answer. But there are different mediums that's coming in. Now that merges, unless the person, somebody listening, who is not connected with this conversation, it's not useful at all. The same thing happens in every aspect of that life which we are going into. As a physician, most of the times I thank somebody at the end of the conversation. I say, you just thank your giddiness because of which you came in, or your cough, a simple cough.
Yes.
They come in and they say, why is it cough? Then we go. Not necessarily every illness should go to the context of spirituality. But wherever there is an opportunity, don't leave that, if they are already open. Otherwise, as you said, initially 1 or 2 days, you give them the faith support, saying that take this medicine or do this kind of a activity, or even if it is a supplement or even a meditation, which will help you, it will calm down. Moment there is bit relief, then they get inclination towards it. So once that field is set, less like a farming, once the field is set, now you sow the best seed there, or which seed is already there, nourish it. Take it up, and you get the beautiful life coming out of that as a sapling or the plant, and then it goes further as a huge tree.
This is so apt for people who are suffering from fear of death and disease, and that's one of the most common symptoms that we see in people who are mentally disturbed. And it is so surprising that Veda has answers and solution and the real medicine for all such complications that's developed. That's beautiful, doctor. Now, this was just constantly putting me into the feeling of self-inquiry. So the connectedness between self-inquiry and the Vedic study. So is there a correlation? Can we dive in deeper into understanding ourselves with the Vedic wisdom and vice versa?
See, again, we should go back to the same question, is spirituality and practical are not different. They are not even parallel. It's a one. So, moment you start looking both as same, then it's a different world altogether. If you look at spiritual world as separately, you see there are some ashramas which will be very specialized in that, and then a corporate office specialized in that. Both of them are incomplete. Now, where these two can come together and then go forward, this is where the completeness of the whole creation is meant for it, not to get away from something. That is one thing. And then how the Veda looks at all these not necessary problem, it is an evolution that is happening. Okay, that's where we are looking into how this step by step it is going on. Now this self, what we are calling, a classical example is something like going to a depression. Depression we feel in a surface level as something, but from the Vedic point of view, even depression is one of the ways of selfishness, ego.
Okay.
A person, if you look, even when I heard for the first time, even I was taken one step back. How can depression can be selfish? Because we feel selfish is something I do only for good things for me. No, something I feel that I am limited. I get depressed. of so many things. People are not talking to me, people are ignoring me.
I'm not getting what I
Yes,
want.
that is identifying myself with this, my name or my profession or something in between me. So that limitedness
This
is the
is a whole
self.
new approach. Yes.
Now this is also selfish. Now moment you start becoming selfless,
Right.
then with somebody ignoring, you say that okay, they may not be interested.
You're just accepting it.
Yes, you are not accepting is first step. Then you say that this shouldn't make any difference to me. And even when I do something good, don't try to see that something comes back immediately, because for them it's not necessarily they give it immediately. Many times we are bad in expression, especially you see fathers. They're very bad. They have all the lots of love inside and they never expresses. So this we see in the movies also. So this is again the same thing is happening. The father inside me, it's not expressing completely.
Okay.
Now how do I take out? There is a step-by-step approach of what we call it as a sadhana. Now you see what is in me making me fixed to something. This is me, this is myself, and I am finite. And this is all I can do, and then I cannot do. Who is actually telling this? That is where the first question of Bhagavan Ramana Maharshi, we have this, who am I? It is both a question and both an also answer. If you take out the question mark, you can make it exclamatory mark. Am I is something. So it's a wonder. So who is actually asking this question? You go there. And from there again you get further. So in this way we can approach the Vedic knowledge. Veda knowledge is, that's why it is called eternal knowledge and the Sanatana. Sanatana is, it is applicable to all time, all place, everyone and always. You take it to any context. It may be just a science, what we call the physical science outside, or it can be something to do with the medicine or anything. It is applicable to all, everything in the creation and which is not created also. Because what has been manifested or created is only a small aspect of that. Purusha Sukta beautifully explains that. A pada, a quarter of it or a part of it is manifested as an iceberg, tip of the iceberg, then the huge thing that is not manifested. The same thing is within me. And then we should use this body as a laboratory. The sadhana is nothing but I cannot go and make all the changes in the macrocosm. Why do I have my body? To sadhana. That is where the human is the only, human is a mind, a prani with the mind. Only form in which the growth happens. It doesn't happen in the level of the deva also. Even the deities, there is no growth. That becomes a flat. There is no birth and death, there is no growth. This, in fact, in one aspect, they're like higher levels. The other aspect of there is no growth. The joy is all about growing. Okay, this, and then there is a joy is in the fall.
We are in better position than them.
Yes, it's we have the joy of doing it, because for them, both the pain and pleasure are one. Imagine if you cannot take both pain and pleasure, it happens. But there is a spiritual joy for them, which my mind cannot conceive it. So we are heading towards that. Even in pain, sometimes we feel that yes, the satisfaction. Okay, somebody would have hurt me, but they would have felt happy. Maybe a loved one. So I don't want to just say something bad to them or say you are happy, that's fine. So that is still not a higher spiritual, but still there is something you get a satisfaction out of it. Or even a childbirth. The mother is, it's almost like another, it's coming out of death. But the joy you see when it comes, the baby is out, because there is something, a new creation that's happening physically. This is what the Veda is trying to see. These are all beautifully explained in the mantras. These are the, like the revelations. Some words, something like a revelation are very important to ponder on. They get that revelation. When I say, when do I get revealed? This is another beautiful word. Such words are very fantastic to get or even meditate upon.
Wow, beautiful, doctor. I think all the challenges that we experience are inevitable. We cannot hold a remote control on all this. So to have these insights within us, to, as you said, sadhana, to do this sadhana, to initiate it and not wait for a challenging circumstance, makes us better equipped to embrace these experiences more gracefully. And I think when we sit across the table seeking help from a doctor or a therapist or a counselor, we are in a better position to understand that and integrate it. Wow, this is fantastic, very beautiful, and we are very keen to learn more about all this. But viewers, you'll have to wait for our next episode for this, where we will also share insights on stages or qualifications that is required to dive in deeper into this bliss. I'll see you again in the next episode. Until then, do take care of yourselves. And if you like this information, do not forget to share this with your loved ones and subscribe to our channel. Thank you so much, Doctor. Namaste, viewers.